Dear friends, today I'm going to discuss with you the risk factors for developing breast cancer. This is a very important topic because this concerns all the women of the world and more specifically all the young women, the young working women of the world. As I had told you before in my previous talk, that there is a marked disparity in the risk of developing breast cancer amongst the places with high human developmental index compared to countries with low human developmental index. This is a very interesting and a difficult phenomenon to be explained, that why is developed countries having such a high incidence of breast cancer, whereas the developing countries, the cumulative risk is much less. In a previous talk, that if you are a citizen of UK, you have a 10% cumulative risk, whereas if you are a citizen of India, it's only 4. Why? Why is it so? What is so sinister that it has catapulted the women of these developed countries into this danger zone? What do you think? Why is the incidence of breast cancer increasing at an alarming rate? And why is the trend changing? Earlier, we used to see women above 65 years presenting with breast cancer. But now, more and more young women are falling prey to this dreadful disease. And this trend, which was predominantly seen in the Western world, is now a global phenomenon. Please think about this and do share your thoughts in the comment section. As for me, I have been thinking and analyzing this trend for the past couple of years, and I feel that I can give you a brief synopsis of the events and factors that are responsible for the present pandemic of breast cancer, more so in the young women. The point is, why am I telling this to you? Because firstly, it seems that nobody else in this world is concerned about the young woman, the young working woman suffering from breast cancer, and is not talking about it. Nothing has been done. Secondly, I feel that if we understand this, the risk factors, we can implement the correct solutions, which to some extent I will discuss with you in detail when I will be talking on how to prevent breast cancer. If we implement this, we will be able to not only stop this trend of increasing the number of cases, but in fact decrease the number of cases globally, most importantly decrease the risk in the young women. So please understand this, for we can save so many lives and we can actually make a difference just by knowing the risk factors and following the 3 A's if we act in time. A brief perspective which has been responsible for this pandemic that we are facing now. See, there has been a disproportionate increase in the cost of living everywhere, globally. Everything has become very expensive. It happened earlier in the industrialized countries and it's happening now in the developing countries. It is no longer possible for a family to run the household on one source of income, and that is the man's salary. Seeing this, the women of the house who wanted to contribute to the financial stability and meet the ever-increasing expenses of running a household joined hands with their men and started working in order to meet their expenses. This is how the women who were once housewives stepped out and left the comfort of their houses to become so-called career women, and they brought about a revolution. Unfortunately, not realizing that they would have to pay a very heavy cost at the end of the day. Today, regardless of which part of the world you are from. Every girl aspires and dreams to be in a position where she can contribute to the family financially, be financially independent herself, and become something in life, to become a professional, follow her passion, develop and utilize her full potential to achieve what she wants to achieve, be it a lawyer, doctor, engineer, scientist, astronaut, sportswoman, journalist, actress, rock star, pop icon, chef. The list is endless. Today, every woman wants to live her life on her own terms. She stands shoulder to shoulder with a male counterpart in all spheres of life. But it is not so easy. In today's competitive world, she not only has to compete with men, but also other women. As a career woman, she dedicates her whole energy, effort, and life to achieve success in a professional world. But unfortunately, she is forced by circumstances to sacrifice and alter her biological reproductive clock for her career. And what does she get in return for this sacrifice? The pain and agony of 5 to 7 fold increased risk of developing breast cancer. This, my dear friends, is the reason why in developed countries, places with high human developmental index, where the proportion of women, of working women, is higher, where the women are becoming mothers after 30 to 35 years of age due to their career requirements. This increases their risk for breast cancer several folds and explains the disproportionate increase in the number of breast cancer cases in young women. How? I'll be explaining to you about this in a few minutes. In the developing world, countries with low human developmental index, the scenario is also changing. With a change in the mindset of the society, equal opportunities are being given to girls in all spheres of development. More and more women are now opting to pursue their dreams and become career women. And the same story of the Western world will be repeated again if we don't act now. I would request you to please follow this crucial talk, which will be in few parts, as I will be going in detail about all of these important risk factors, so that you understand the risk factors and subsequently I will guide you what you need to do to reduce the risk of developing breast cancer. Now, one of the most crucial fact that you must remember is that 85% of breast cancers occurs in women who have no family history of breast cancer. I will repeat it again. About 85% of breast cancers occurs in women who have no family history of breast cancer. This is very important. Majority of the women of the world wrongly assume that they cannot get breast cancer because they don't have a family history, and as a result of which they ignore or neglect the early crucial signs of breast cancer. This results in late diagnosis, and then they and their family have to bear the consequences. So please understand this very important and crucial fact. If 85% have no family history, then how does breast cancer occur? Okay, a lot of factors are believed to play a complex role. Some we can modify, some we cannot, such as the natural process of aging and genetic mutations that happen as a result of life in general. The most significant risk factor for breast cancer are gender, that is being a woman, and age, that is growing older. And both of these factors are obviously not modifiable. So before I begin, there are two important concepts which you must comprehend. They will definitely help you to understand the crux of the situation and make you conscious about the risk factors of breast cancer. Firstly, I have divided the risk factors into two categories. Modifiable, that is, those factors about which we can do something about to decrease the risk of developing breast cancer, and non-modifiable. These factors are not under our control. For example, a family history of breast cancer. In this, there is double or triple the amount of risk for the woman because she can have both, that is, modifiable risk factors also in addition to the non-modifiable risk factors. Secondly, what is the purpose of knowing these risk factors? Please remember the 3 A's and BP, which I discussed with you in my previous talk. BP stands for Brahms Protocol. And I talked about earlier the triple A's: aware, avoid, assess. So the first aim is to be aware about these risk factors, and then the second A, that is avoid or modify the risk potential of these factors, and then if you feel you are in a particular risk group that increases your probability of developing breast cancer, assess. Get yourself evaluated by a doctor and activate the Brahms Protocol, BP.